Does the U.S. need health insurance reform? To discuss this, we're bringing in Jeffrey Tucker, founder and president of the Brownstone Institute and Senior Economics Columnist for the Epoch Times. Jeffrey, always great to see you. So does the system that finances healthcare need reform in your view?
Desperately, and the Republicans have been given a golden opportunity by President Trump, who tweeted out that the government's money should go directly to taxpayers rather than insurance companies, which he called corrupt and overfunded. And that's exactly right. I mean, so this is a brilliant opportunity for them to entirely reform health insurance. What matters here is that, even if the money goes if government money goes not to health insurance companies but to individuals, they still face a very truncated marketplace where you can't just get catastrophic insurance. You have to buy into one of these predefined benefits packages, and the cost of this insurance is going through the roof. It's at $27,000 per person and set to rise much higher over the coming months and years. So what I'm suggesting here is that Trump is exactly right. The money should go to individuals instead of insurance companies, but the marketplace for insurance needs to be entirely opened up. So insurers need to be able to offer a menu of options to individuals, and that their premiums should be adjustable based on the risk of the individuals who are being insured. And that would do the most possible to reduce premiums under these emergency circumstances.
So, Jeffrey, a couple of things. Now, you say that we should rather have government funds go directly to citizens instead of insurers. How would this help? What's the impact of that? I would imagine insurers might not be too thrilled about this.
Oh, no, they'll be very unhappy about it, of course. But that's one of the biggest industries in the United States, and it's heavily subsidized by government. And there's no cost controls associated with healthcare now. The insurers are very much in charge of people's healthcare rather than their doctors. If we can just change the system so that we can restore that doctor-patient relationship, that would go a long way towards reducing costs. And a very beginning step of that is to give the money directly to individuals instead of to the insurers, and let the individuals shop for the best health care expenditures. The problem is that once they get out on the marketplace, they find that there's not really available a kind of a market base of options. I mean, just one, for example, everybody's being forced to pay for mental health coverage whether they want it or not. And that's just in these defined benefits packages. That's how this works. And the costs of them are going through the roof. People are paying for insurance they don't even use. And the deductibles are so high that once you start using it, then your costs are really going to increase. So this $27,000 figure I mentioned, that's before you use any of the actual health care. This is just to get you in the door. But once you start using the services from these exchanges, then they come after you for everything you're worth. And for a lot of people, their health insurance is higher than their rents or their mortgages at this point. So we've approached an emergency situation. Trump knows this. It's harming him politically and harming the Republicans politically. So my argument that I said in this Epoch Times article is that under these conditions, the Republicans need to act immediately to not only enact Trump's proposed reforms, giving the subsidies directly to individuals rather than to insurance companies. That will help reduce costs. But then after that, we still have many other substantial reforms to make that would change a lot of the logic of Obamacare. They called it the Affordable Care Act, but it's not affordable at all. It's completely unaffordable. There are ways to fix that, but it's going to mean getting into the wires of the system and pulling them out and replacing them with something much more market-oriented that restores the doctor-patient relationships.
So, Jeffrey, can you talk a little bit more on what needs to happen to eliminate some of the problems in the system? You mentioned a couple of them already. Maybe you can talk about a bit more.
Yeah. Okay. So one of the issues is that when you get life insurance, the very first thing they do is they check, and they have the actuaries come in and check your risk, and your premiums are assessed based on your risk. Because the insurer wants to make money and you want to be insured. So that's how we have a competitive market for life insurance. The same thing is true in home insurance. If you're living on a floodplain, you're going to pay more than you would otherwise. And the same thing is true with auto insurance. If you get a lot of tickets, you're going to be paying higher premiums because insurance is necessarily related to risk. Now, incredibly, Obamacare changed that system in healthcare. So it doesn't matter how healthy you get. I could be tremendously obese and inactive, and then lose a bunch of weight and join a gym and become a major athlete who's exercising every day. My premiums won't change at all, even though my risk profile has completely shifted. So we need insurers in the position of insuring not just these large pools of risk, but individuals. And that way, individuals will face an incentive to get healthy again. Right now, we've got this Make America Healthy Again movement, and everybody's telling you get healthy, but there's no financial benefit to you directly in terms of what you're paying for your health insurance. If you would benefit financially, so you realize, okay, being overweight is costing me $500 per month, you might rethink your diet and your exercise regime, because everybody wants to save money now. Getting healthy and saving money are the same thing under what I'm suggesting. This was the way the system worked in the past before Obamacare. But Obamacare came in and pooled all the risks of so many groups. And sure enough, over the last 15 years, Americans have gotten tremendously unhealthy as a result. And I think this is one of the reasons why. So if we could just restore something like a system where the actuaries assess individual risk, where individuals control their healthcare spending, and they can choose among a menu of options from all insurers, and ideally that the HSA system, health savings accounts, could be extended to everybody, regardless of their insurance status, so that people could save money tax-free, spend it on a range of healthcare options. That would all dramatically reduce the cost of healthcare in this country instantly. And what I'm saying is that the Republicans could and should pass such a comprehensive sweeping bill immediately while they have the majority, and that would dramatically reduce healthcare spending and increase the health of Americans.
So you were talking about this point as well, Jeffrey, in your article on the Epoch Times. I read it earlier today. You were saying that someone who smokes or drinks, they quit that, or they're overweight and they lose the weight. It has no impact on how much money they pay. So my question is, can health insurance become that granular?
Yeah, well, it used to be that granular. It's the same. Again, it's granular for life insurance, granular for homeowners insurance, and it's granular for car insurance. Now, all those are all too high, but can you imagine if you had to share risk pools with a million other people, and that your great driving record wouldn't have any effect on reducing your premiums, or your health wouldn't change any of your premiums in your life insurance? That would be a completely crazy system, but that's exactly the system that we've implemented in healthcare. Now, the excuse they've given is that they don't want any discrimination for against pre-existing conditions, and that's a noble desire. But what it's done is it's taken out the market logic of all health insurance. There are surely ways that we can insure people who have pre-existing conditions while also rewarding people for getting healthy, for being healthy, so that they pay less insurance. This is really important. People forget that your health is very much connected to, in most cases, to your own life decisions. So we need the economics of the health insurance industry to match with people's own individual decision-making incentives to get healthy. That will, by itself, massively reduce the burden on the healthcare system and lower prices. And my suggestion is that we have to do this, like right away, because right now, at the level of premiums that are being increased right now, the Republicans are approaching the political danger zone and being blamed for a system that they didn't set up. This is all Obamacare that did this. And it's up to them, up to the Republicans, to finally just get rid of all the guts and machinery of that entire system that has driven up healthcare insurance prices so high and healthcare prices so high. We've got a system that doesn't even have posted prices. And the insurers are running everything. The insurance companies are telling doctors what they can do without any posted prices for the consumer. This is making people very angry. And I think the Republicans could gain a great deal of popularity with their base and with the American people more broadly by finally doing something about it and bringing a market-based, actuarially driven system back to healthcare, just like we had it before, but better.
Okay, well, Jeffrey, that's our time today. It's always a pleasure to speak with you. Thank you.
It's my pleasure. Thank you very much.